If you've ever been told your PSA is a little high and that you might need a biopsy, I want you to pause with me for a moment. Take a breath, because here's what many people don't realize about PSA testing. The number itself doesn't tell the full story. I'm doctor, a board certified urologist, and over the past 10 years, I've sat across from hundreds of men who came in worried after seeing a PSA result flagged as abnormal. Some were anxious, some were confused, and many asked me the same quiet question: do I really need a biopsy? And the honest answer is not always, let me walk you through this, the same way I would if you were sitting in my clinic. PSA, or prostate specific antigen, is a protein made by the prostate. We use it as a marker to help assess prostate health. It can be elevated in prostate cancer, yes, but also in very common and non-cancerous conditions like prostate enlargement, inflammation, or even after activities like cycling or recent ejaculation. So right away, PSA is not a cancer test. It's a signal, a clue, something that needs interpretation, not just reaction. For many years, one number became widely used as a general cutoff. If PSA was above that number, it raised concern. If it was below, it was often considered reassuring. That approach was simple, easy to remember, and widely adopted. But human biology is rarely that simple. As men age, the prostate naturally grows. This is a normal process. A larger prostate produces more PSA. So it makes sense that a man in his 70s would typically have a higher PSA than a man in his 40s, even if both are completely healthy. Now let me ask you something. Does it feel reasonable to judge both of those men using the exact same standard? This is where many misunderstandings begin in real-world practice. One of the most important things I look at is whether a PSA level is appropriate for a man's age. A PSA that might raise concern in a younger man could be completely expected in an older man. And the opposite is also true. I remember a patient in his early 70s who came to me extremely worried. His PSA was slightly above what he had been told was the normal limit. He had already been advised to consider a biopsy, but when we looked more closely, his prostate was enlarged. His PSA had been stable for years, and when we adjusted for his age and prostate size, his result fit well within what I would consider expected. We didn't rush into a biopsy. We monitored him carefully, and over time, nothing concerning developed. On the other hand, I've seen younger patients with PSA levels that technically fell within what many people think of as normal, but for their age, those numbers stood out. In those cases, we took a closer look, sometimes leading to earlier detection of meaningful disease. This is why context matters so much. Another piece of the puzzle that often gets overlooked is PSA density. This simply means comparing the PSA level to the size of the prostate. If someone has a large prostate, a higher PSA may be perfectly proportional. If the prostate is small and the PSA is relatively high, that may raise more concern. Think of it like this. If two people have the same PSA, but one has a prostate twice the size of the other, the interpretation should not be the same. Then there's PSA trend. This is one of the most valuable tools we have, yet it's often underappreciated. A single PSA number is just a snapshot, but a series of values over time tells a story. Is the PSA stable, slowly rising, rapidly increasing? A gradual, minimal change over several years is often reassuring, especially in the setting of prostate enlargement. But a more rapid increase may prompt us to investigate further. So instead of reacting to one number, we step back and look at the pattern. Now let's talk about biopsy, because this is where anxiety understandably rises. A prostate biopsy is a procedure where we take small tissue samples from the prostate to look for cancer. It can be very important and in some cases life-saving, but it is still an invasive procedure. It comes with potential side effects. These can include discomfort, bleeding, infection, and emotional stress. Most men do well, but it's not something we recommend lightly. And here's the key point I want you to understand. Not every elevated PSA should lead directly to a biopsy. In modern urology, we often use additional tools before making that decision. These may include advanced imaging like MRI, repeat PSA testing, or other specialized blood or urine tests that help refine risk. The goal is to avoid unnecessary procedures while still identifying clinically significant cancers early. Because there's another important reality we need to acknowledge. Not all prostate cancers behave the same way. Some are aggressive and require treatment. Others are slow growing and may never cause harm during a man's lifetime. In those cases, we often recommend active surveillance, which means careful monitoring rather than immediate treatment. This approach helps avoid over-treatment and preserves quality of life. Now, you might be wondering, so what should I do if my PSA is elevated? This is where shared decision-making becomes so important. Instead of asking, is my PSA above a certain number, I encourage you to ask a different set of questions when you speak with your doctor. Ask whether your PSA is appropriate for your age. Ask how your prostate size factors into the result. Ask about your PSA trend over time. Ask whether additional testing could help clarify your risk before moving to biopsy. These are thoughtful, reasonable questions, and a good conversation with your urologist should leave you feeling informed, not rushed. I also want to address something I see quite often: fear. The word cancer carries weight. It's natural to want immediate answers and quick action. But sometimes the best care involves careful evaluation rather than immediate intervention. Taking a little time to gather more information does not mean you're ignoring a problem. It means you're approaching it thoughtfully, and that's exactly what we aim to do in patient-centered care. If you've never had a PSA test and you're wondering when to start, that decision should also be individualized. Family history, overall health, and personal preferences all matter. Screening is not one size fits all. And if you've already been through testing and are navigating next steps, know that you have options. You have time to ask questions. You have the right to understand your results fully. You are not just a number on a lab report. Before we wrap up, I want you to reflect on this. Have you ever been given a medical result without full explanation? Have you ever felt unsure about whether a recommended test or procedure was truly necessary? If so, you're not alone, and this is exactly why conversations like this matter. My goal with urology for you is to give you clarity, not confusion, to help you feel calm, informed, and confident when making decisions about your health. If this discussion helped you better understand PSA and prostate health, I'd really appreciate it if you took a moment to like this video and share it with someone who might benefit from it. And if you haven't already, subscribe to the channel. I'll be continuing to break down important urology topics in a way that's practical, honest, and grounded in real clinical experience. I'd also love to hear from you. Tell me in the comments where you're watching from, and if you feel comfortable, share your experience with PSA testing. Your story might help someone else feel less alone. As always, take care of your health, ask questions, and remember that good medical decisions are made together, not in a rush. I'll see you in the next preview.